Why your wisdom teeth cause so much pain. A 3D journey. Ever feel like there's a tiny, throbbing volcano erupting in the back of your jaw? That's often your wisdom tooth, making its grand and usually painful entrance. In the next few minutes, we're going on an incredible 3D journey deep inside your mouth to uncover exactly why these latecomers cause such a fuss and so much discomfort. Section 1. The problem. The why. Wisdom teeth, those final molars, often feel like they're crashing the party a little too late. They typically try to appear between 17 and 25, just when you thought your mouth was settled. But here's the kicker. Our modern jaws often just don't have enough room for them. It's an evolutionary mismatch, leading to what dentists call impaction. An impacted wisdom tooth can be a real pain, literally. Instead of neatly popping up, they might get stuck beneath the gums, grow sideways, tilt awkwardly, or even remain completely hidden. This isn't just an inconvenience, it's a recipe for trouble. We see different kinds of impaction. Soft tissue impaction. Your gum partially covers the tooth, creating a tiny little hideaway for food particles and bacteria. It's like a tiny festering pocket. Partial impaction. Here, the tooth breaks through a bit, but not fully. This creates an easier environment for bacteria to flourish, making cleaning nearly impossible. Full impaction. The tooth stays entirely beneath the gum line, often pressing directly against the jawbone, or even worse, pushing into its neighboring tooth. Ouch! This constant pressure from an impacted tooth can really take a toll. It leads to significant inflammation and discomfort, making the entire area around the tooth feel swollen, tender, and downright painful. It's your body's way of screaming for attention. Section 2. The agitation. The what if. Now, if you're thinking, can it get any worse? Well, sometimes it can. Ignoring these early warning signs isn't just about enduring a bit of pain, it can lead to serious long-term consequences for your oral health and beyond. First, that persistent pressure can cause damage to nearby healthy teeth. It can lead to them shifting, becoming misaligned, or even developing root damage. Imagine your perfectly straight smile slowly getting nudged out of place. Then there's the risk of infection, a common culprit for severe wisdom tooth pain. Those partially erupted teeth and gum flaps, they're prime breeding grounds for bacteria. This can lead to pericoronitis, where the gum tissue around the tooth becomes red, swollen, and incredibly painful. It's a full-blown infection. Left unchecked, these trapped bacteria can cause infections that lead to swelling, pus, and sometimes even fluid-filled cysts forming in the jawbone. These cysts can weaken your jaw. If the infection spreads, it's not just a dental issue anymore. It can become a broader health concern, potentially leading to systemic symptoms like fever and swollen lymph nodes. Plus, chronic bad breath and an unpleasant taste are hardly ideal. Another often overlooked problem is tooth decay. Because wisdom teeth are so far back and difficult to clean properly, they're much more susceptible to plaque buildup and cavities, adding another layer of pain and sensitivity. Section 3. The solution. The how it's fixed. So, what's a person to do when these troublesome teeth decide to act up? The most common and often most effective solution is extraction. It might sound daunting, but let's take a look at what that involves through our detailed 3D journey, so you know exactly what to expect. First things first, your comfort is key. The dental team will apply local anesthesia to thoroughly numb the area, ensuring you won't feel any pain. Sometimes, if you're anxious, they might offer sedation to help you relax. Next, if the tooth is still covered, a small, precise incision is made in the gum tissue. This gently exposes the wisdom tooth, giving the dentist clear access to the problem. Don't worry, you're still completely numb. If the tooth is fully impacted or growing at a tricky angle, the dentist might need to section it, essentially dividing it into smaller pieces. This clever technique allows for easier, less invasive removal, often minimizing the amount of bone that needs to be moved. It's all about making the extraction as smooth as possible. And finally, once the tooth or its sections are out, the dentist will meticulously clean the site and, in most cases, place a few dissolvable stitches to help the gum tissue heal neatly. You'll be given clear instructions on post-operative care for a quick and comfortable recovery. And there you have it. The extraction resolves the source of the pain, removes the potential for future complications, and sets you on the path to better oral health. Conclusion. So let's recap this intricate journey. Those pesky wisdom teeth can cause a world of hurt due to impaction, pressure, inflammation like pericoronitis, and potential infections. But the good news is, with proper dental care and, when necessary, a straightforward extraction, you absolutely can alleviate that pain and protect your overall oral health. Remember, if you're experiencing any of these telltale signs, that nagging jaw pain, swelling, or persistent discomfort around your wisdom teeth, please don't wait. Schedule an appointment with your dentist. They're the experts who can accurately diagnose the issue and guide you through the best course of action before things escalate. If you found this 3D dive into dental anatomy helpful and insightful, don't forget to give us a like and hit that subscribe button. We'd truly love to hear your experiences with wisdom teeth in the comments below. What was your journey?